Who decides who is a public health risk? It appears King Cuomo in New York might be able to pretty soon. A Democratic lawmaker in New York has proposed a controversial new bill that would allow the governor or his surrogates to round up and detain individuals who are considered a threat to public health. That's right, you heard it correctly, folks. Joining me now to discuss this and also the status of the vaccination program across the country, we have Dr. David Samadi. He's the author of The Ultimate Manual. Doc, good to see you again.
Good to be with you. Thank you.
Let's start with this. What do you think, as a medical professional, as an MD, when you're seeing this bill authored by Democratic Assemblyman Nick Perry calling for the removal or detention of people who are potentially dangerous to public health? I mean, does it feel like we're still in the United States? Because it doesn't seem like there's a lot of checks and balances or rights taken into account here.
I think this bill is very, very concerning. It's really unconstitutional. I actually posted this on the Twitter as one of the first people, and I was extremely concerned about this. I think it's dangerous because it gives the authority to some of these people, like the governor and other people, that they can decide who is going to be the health hazard. It gives them the power to basically like detain people and take them to what we call these like health centers. It almost reminds me of being back in Middle East. You have no human right. They can do whatever hell they want. Your mask could be around your neck for like 2 minutes and you're gone and nobody will know exactly where you are and what's going to happen to you. This is not an American way. This is not the way we run things in this country. And I'm not sure exactly who and how they came up with this bill. Initially, it was supposed to be for Ebola years ago, but they are modifying it to gives them enough power that they can do anything they want. And I think it should absolutely be stopped right at the beginning. There's no room for this.
And you mentioned Ebola. I mean, isn't it fair to point out, because I've seen some, at least Twitter lawyers, people that all of a sudden, if they have a degree in the law, it's one that they only seem to use when they're doing the Democrat Party's bidding. But they're saying, well, quarantine has existed for a long time, which is true, but quarantine is supposed to be for sick people for a disease that has a high likelihood of spreading and perhaps killing other people. We're talking here about just whatever. I mean, the government, it sounds like, is taking the position that even if they think you may, so if you've been exposed, for example, to somebody with COVID, not even necessarily that you have an active infection, the governor of New York would be able to say, well, you have to go to a facility now.
That's exactly right. And that's one of the reasons why a lot of people that are asymptomatic, they're not really hazard to any community, and they may have been recovered, or you may have just mild symptoms. They're able to really take you. And that definition is so broad, and it's just not going to work in America. And why they would put a bill like this is beyond. And it tells you how New York is changing. You have hundreds of thousands of people that are leaving this city. The economy is collapsing over here. And all you see is the hotels, real estate is going down and more homeless as a result of bills like this that doesn't make any sense anymore. New York is becoming another Chicago and another San Francisco. And it's just, it's a sad situation to see this country and New York City is going down, and something needs to be done about it.
Doc, what can you tell us about this new strain that's being reported on, as this extra contagious strain of COVID-19? They're now saying it's found in upstate New York, and California's Governor Newsom has said that there are 6 new cases of this variant. Are we expecting the vaccine will be effective against this as well? Is this a cause for additional alarm?
Based on the studies that I've seen, the vaccine seems to be working and it's still effective. And it absolutely should reduce the symptoms of COVID. And at the same time, it's important for people not to panic. We see mutation with coronavirus all the time. Yes, it is going to be more contagious, but it doesn't necessarily have to be more lethal. So I think, it remains to be seen. We need to, again, protect our elderly, nursing home, people that would have comorbidities, heart disease and others, and let the younger people with caution and be careful and go out and open up our economy.
And Doc, what are you seeing so far in the vaccination protocols in terms of the administration of this, the way that government authorities, state authorities in this case, are distributing the virus? It seems like some places in D.C., for example, the health authorities have put out a look, don't let it go to waste, because that's actually been happening. People have had vaccine that they thaw, and then they don't have somebody set up to take the full amount of doses, so they end up throwing in the trash. They're saying at a minimum, just get it into someone's arm who wants the vaccine. So there are clearly problems. What's going right and what's not at the state level from what you're seeing with this vaccination process?
Well, I think the president has done an amazing job by coming up with this vaccine in only 9 months or 10 months or so. Don't get upset if I say we have the vaccine. I'm not promoting the vaccine to a lot of people who are saying, oh, Dr. Samadi is saying like we should get vaccine. It's your body, it's your choice, but it's available to a lot of elderly people, and the president should get credit for it. The distribution is a little bit of a problem. We're hitting some roadblocks, but the vaccines are available. Millions of them are going to be coming out in February. More vaccines are going to be coming out in the pipeline. So I think, in the next month or so, we're going to see that after nursing home, doctors and nurses, this will be available to the public as well.
Doc, before we let you go, the state of California has had a 1,000% increase in hospitalizations. I believe it's over the last month or so. So they're seeing an enormous increase in hospitalizations from COVID-19. There are still people going on TV, Dr. Gupta at CNN, Dr. Fauci, all over television, the internet, saying that masking is the only tool that we really need to flatten the curve, or rather I should say, and I would edit this, the most effective tool we have, even more so than vaccines. If that is true, why is California, a state that has one of the highest levels of mask compliance, seeing what looks like uncontrolled and is certainly unprecedented degrees of spread of the virus?
Well, I think, besides masks, they've been talking about lockdowns. And the states that have done more lockdowns in the past, few months, are now paying the price. The ones that have been a little more lenient and people have gone and already have antibodies, they have a much better economy and they're doing well. I mean, you go to Florida, you see people, even though the numbers are there, but the situation in places such as California that have had very aggressive lockdown is much worse. So I think the science behind this, there's a lot of fear and panic. And we need to really get to the bottom of a real science, not a lot of things that's going on in the mainstream media.
Dr. Samadi, appreciate your time. Thanks so much.